Hi, I'm Chrissy Scoggin. I'm a third-year vet student at Texas A&M, and I'm here today to talk to you about a physical exam. So the first thing we're going to do is we all want our loved ones to stay healthy and be happy, so that includes our family and our friends and of course our pets. So the objective of today is that after this, the students will be able to explain to me how to do a physical exam and why it's important. I'm also going to tell you about the vital signs and what they are, and even show you all how to do them at home so that you can check on your own pet. And then we're going to do a physical exam, of course. So first off, some questions for the students. Do any of you students have pets? Have you gone to the clinic with your parents when you had to take your pets into the vet? And what does the vet do when you have to take their pet in for your yearly appointment? Those are all great things. So why is a physical exam important? Physical exam allows us to find signs of sickness that aren't obvious to people out in the world. There are very subtle signs that veterinarians can pick up on, and we can get out of histories and other things like that help us figure out what's going on. And then it also helps us tell the extent of the injury or illness. How bad is the fracture, or is it really, really sick that we need to keep them in the hospital and take care of them, or can we just give something to take home and take care of at home? So on a physical exam, you look at all the body systems and how they're working together. All the body systems are related in function. I know that in 8th grade they study body functions and how they work and interrelate and stuff like that, so this will be pretty good. You all will understand this. And then if one doesn't work properly, it may limit what we can do medically. So if the kidneys aren't functioning properly, we can't give certain antibiotics or other things like that. Or if the liver isn't 100%, we can't do certain things. So we need to look at all that to make sure that everything's going good. And then veterinarians, with the training, they may pick up on things that are significant that owners might not notice. Like you will hear a heart murmur at home because you don't have a stethoscope. Or we know that a 9-month-old puppy of that breed should be a certain size and should weigh a certain amount. So we can pick up on things like that. Skin problems that you might think is just a little dry skin, but it's something bigger to us, or even parasites that you don't notice because they're mostly internal. So the first thing we do is look at the history. We'll get a good history from owners. We like to ask questions in many different forms, like, what are you feeding him? How much are you feeding him? What kind of foods are you feeding him? Just to make sure we get an overall picture. And then we always have to listen carefully as veterinarians so that we can hear on little things that the owners might not even be meaning to say, but they're saying to us that we pick up on. And then we ask tons of questions. I don't know if any of you have been in with your parents when a vet has taken history, but most of them ask tons and tons of questions, but that's how we get everything we need to know. So a veterinarian will start his physical exam when an animal actually walks into the room. They're going to be getting an overall impression of the animal. How is its gait? How is he moving? Does he look like he needs to put on weight? Does he need to lose weight? Is there a lot of muscle? Does he have good tone? Does he have atrophy, which is just loss of muscle in a certain area that might clue us into something that's going on? And then they also look at behavior and attitude. Some dogs come in and you can just tell by looking at them that they're hurt, they don't feel good, or even aggression. We need to know that so that we can protect ourselves and owners and our staff. So there are a lot of things that a vet will need to do a physical exam properly, and I have brought just some of them with me here. I actually have here a couple of different stethoscopes. This is actually a pediatric stethoscope. It has a smaller head on it for small animals. You can use this on kittens, puppies, even small pocket pets like hamsters and gerbils and ferrets and such. And then we have a larger stethoscope. It has a larger head on it. You can use this for dogs, cats, horses, cattle, everything that needs to be done. You can use it on all of them. I don't have an otoscope. I know it's up there, but I have a couple of different thermometers that we use. This one here is an ear thermometer, and an ear thermometer is great because you don't have to stick it in the rectum, which is how we normally take temperatures on animals, which isn't very much fun. We can't do it orally, but this one goes in the ear, so it's a little more comfortable for the animal. This is a veterinary thermometer, and it's just a normal everyday. It's just like what I'm sure your moms and dads have at home for you. This last thermometer is a pediatric one, and it's just actually, it does it in like 3 seconds, so it's a lot faster, and we like to use these because they are faster and it's less discomfort for the animals. And then we have some things for specific, this is called a neuro hammer. We use this for a neurologic examination to check muscle tone, muscle mass, and how they react to stimuli. And then we also have pin lights. These are both pin lights. We use both of these to go ahead and look in the eyes of the animal, also in the ears maybe, maybe down the mouth if you think there's something, just anything that you need a little bit extra light for. So that's all the things I have with me today, and those are all things that every veterinarian will use in on a normal physical exam. So the first thing a veterinarian might do on a physical exam is listen to the animal's heart and lungs. And I have on here what a normal heart sounds like so that you all can hear it. And I'm going to go ahead and play that for you. It's just kind of a lub-dub is how it's always explained. And you listen for that. You might listen for any irregularities. If it doesn't sound like that, you know it's abnormal and it's something that we need to check into. And then you can also listen to the lungs. When you listen to lungs, it shouldn't really sound like anything. It should sound like an animal breathing in and breathing out. So next, the veterinarian might take the animal's temperature. And I have just told you we have 3 different types of thermometers that we can use. Normally, most veterinarians will do this rectally because we can't ask an animal to hold that under their tongue and not bite it and stuff like that. So it makes it easier on us, even though it's a little bit more discomfort for the animal, that we do this rectally. So after that, a veterinarian is going to do a head-to-toe exam. Every veterinarian does this differently. I personally start at the head and go all the way backwards. Look at everything. I'll listen to the heart, the lungs. I'll look at each leg and look at everything on the animal. And then if the animal seems to be sick on a physical exam, the next thing a veterinarian might do is need to take some samples, such as blood, maybe urine, even some feces. They're all going to tell us different things. Blood is going to look at an overall picture of the animal. Are they more sick? Are all their organs functioning properly? It's going to give us those kind of things. Urine is going to tell us about the kidneys and how they're functioning. And then feces can be used to look for internal parasites, things that might be in the GI tract that we need to deal with. So if everything seems to be healthy on an animal, the vet is going to give them their vaccinations. Most animals need to have vaccinations at least once a year when they're young, and then as they get older, we might be able to increase that interval to 2 or even 3 years now that we have the 3 years rabies. This is just to keep your animal healthy and prevent them from getting sick in the future. There are some pretty bad bugs out there that we need to protect them against. And they have different vaccinations for cats and dogs and horses and cattle that are all specific for things that those animals might get. So I brought with me here some normal rates on animals, and you can look at that, and it has cat, dog, pig, horse, cow, sheep, and goats. These are all really important things that we need to look at, and you can see how the normal temperature on every one of these animals is actually higher than your own temperature. So when you feel your animal, they feel a little hot to you, but that's normal for them. They have a higher metabolic rate, so they are a little hotter. And then you can also look and see how they're kind of similar together. Most of them have similar breaths per minute, which is the respirations. And then the larger the animal gets, usually the slower their heart rate gets. So little dogs and cats have a much higher heart rate than the big cows and horses and such. So some things that you all can do at home that will be very helpful for a veterinarian if something does happen is watch your animal. I'll show you how to count respirations, and so if you notice that they're not been out exercising and playing a lot, they've just been sleeping, but their respiration has increased, that might be a sign that they need to go to the veterinarian. Or has the heart rate gone up? I'll show you an easy way that you can feel for a heart rate. It's actually called a pulse when we feel it, and so you can kind of see what your animal is normally. And then again, if they've been out running and playing, you expect that to go up a little bit, but if they've just been sleeping and their heart rate is elevated, then that might be something that the veterinarian looked at. Also for swellings, does the animal have a fever, which I don't know that many of you will want to do a rectal temperature on your own animals. It's not really that fun. So, and then has the behavior changed? Are they normally happy, jumping Labrador puppy, and they're just kind of laying around moping? That might be a sign that they don't feel so good. And then they lack energy, they seem depressed. Those are all things that you might need to go ahead and take your animal into a veterinarian. And then I actually have here with me is a physical exam form from Texas A&M. This is from the small animal clinic. This is what they use to make sure that when an animal comes in, they do get a complete physical. You can see on here that we take temperature, pulse, respiration, the animal's name goes here, and then over here it has each body system, so we make sure we look at every single one of them. And if there's nothing wrong, we just put a little check. If there is something wrong, we go ahead and use all these lines to write down what it is, so that in the future anybody can look at this and tell what was wrong with that animal on that day. Okay, now I'm going to go ahead and do a physical. This is Titan. He's my dog. He's here. He's volunteered to do this for me today. So every veterinarian is going to do a physical exam a little bit different than the way I do it here, so it might not be the same as the way that your veterinarian does it at home. I like to start at the head and go all the way back so that it gives me just a systematic way to look at things. So on the head, one of the first things that we look at is we look at the ears. You want to look in there, make sure there's not dirt, debris, anything that shouldn't be in there. Does it need cleaning? Anything like that. We also want to look up here at the head. Does everything look symmetrical? There's no muscle wasting on either side. Both sides look good. You want to look at the eyes. Make sure that the eyes are bright, shiny. There shouldn't be any cloudiness, anything. You want to look at both eyes. This is when you would take your pen light and you would shine it. I'm not going to turn it on for him, but you would shine it in both eyes. Make sure that both pupils can constrict. This is a good thing because when they go outside and it's really, really bright, they need to be able to constrict their pupils. We want to look at the nose. Does the nose look symmetrical? Does it have two openings that he can breathe through? Is there no discharge or anything coming from the nose? We also want to go ahead and pick up the jaws and look at the teeth and the gums He doesn't really like this part. You want to look and make sure they're pink gums and white teeth. At this time also we can go ahead and open the mouth. You can look at the tongue, make sure they don't have anything down in the mouth that we might need to remove. We're also going to go ahead and look. Dogs have lymph nodes here, right underneath the jaw, and also right here in front of the shoulder. We're going to check those. What lymph nodes do is they drain any infections or anything that are in the body that they need to be taken care of, and also any swellings or anything like that. That's where they drain. So we want to check those. If they're enlarged, it might mean that the animal has an infection or something that we need to look at further. So we just want to feel both of them and make sure that they're both, neither one is enlarged. And then we'll move on to the neck. We're going to go ahead and put a little pressure down both sides of the neck. Make sure that there's no pain and that the animal can bend to both sides without any pain. You're going to go ahead and make sure everything feels symmetrical down the back. You can put a little pressure, make sure there's no pain elicited and down the back. We're going to start with each leg. Make sure that you don't feel any big atrophy difference between the legs. You compare the two legs to each other. They should feel about the same. We're going to pick one leg up, bend at the toes. Make sure each joint bends and flexes with no pain or anything to the animal. And you bend them both sideways and front to back to make sure that there's no pain. This is the elbow. You can bend it and straighten it. Make sure there's no pain. And then up here in the shoulder. This is the shoulder area. Pull the leg forward and backwards. Make sure that they just don't have any pain in any of those areas. Now we're down to the heart and the lungs. So we're going to take our steady stethoscope, and to listen to the heart, you're going to put your stethoscope just right here behind the front leg. I can feel his heart. While we do that, we also feel right underneath here, under the back legs, there's a pulse. It's an artery that runs down the back leg, and we can feel it pulse to make sure it's going in sync with the heart. This is also where any of you that want to take your own heart rates on your animal, just gently lay your hand on the inside of your dog's back leg, and you will feel just kind of like a pub, pub, pub. That'll tell you your dog's heart rate if you need to take it. We'll also listen to the lungs. We like to listen to the lungs, two areas up high and two areas down low. You want to listen on both sides because they have two lungs, so you want to make sure that both lungs are inflating nicely. And you also want to listen to the heart on both sides because there's different valves on either side, so we want to make sure that all those valves are working properly. Once you've done that, you're going to move on down to the abdomen. In the abdomen is where you keep most of the internal organs, liver, spleen, intestines, stomach, bladder. You're just going to palpate in there, feel if there's any masses, anything. It should be more fluid, just kind of like there's stuff in there but nothing real hard. Shouldn't feel anything that's like a baseball or anything. So we would feel things for that, feel for things like that. Check to make sure that the organs are the approximate size that they should be for the animal. And then we'll move on down to the back legs. This is one back leg. You can see we'll do again. We'll start at the very tip, bend each toe, bend each joint, make sure they flex. This is the dog's knee, so we'll bend it and make sure that it bends properly. They should be able to bend it almost completely back to touch, and then straighten it back out. And then their hip. The dog's hip is up here. It's a little different than us because they're down on all fours. So if you bring the leg back and forwards, you can tell if there's any pain or anything like that when you move the joints. And then last thing that I do is I would take the temperature, because that's the part the dog hates the most. So you've already gotten him to stand still for the rest of your physical, and you can now take his temperature, and if he doesn't really like you after that, then you've already done your physical, so you don't need him really anymore. And that's the majority of a physical exam. Any of you that would like to also listen to respirations for your dog at home, you can kind of just feel on the side of their chest, very lightly put your hands, and you'll see your hands will move out and in. That's one breath. So you can kind of count. And they're going to be kind of low. I mean, you're talking 12 to 15 breaths a minute. So you're going to be there for a while and maybe not feel a whole lot of breaths. But when they're been out playing, you can better tell this because they'll be breathing a little bit more. That's about all that there is on a physical exam. The more that a veterinarian does this, the faster they get at it. So it doesn't take very long to do, and it gives us a whole lot of information, so it's very important for us. Thank you all very much.